joining us now, Republican Congressman Marlin Stutzman of Indiana. Congressman, thanks so much for being here with us. We appreciate it.
Thanks, Jessica. Great to be with you this afternoon.
I want to start first with there are a lot of questions. Admittedly, this is a blueprint. Now the Senate's going to have to figure out what they want to do. My colleague spoke with Republican Senator Josh Hawley, who said that any potential cuts to Medicaid would be an absolute non-starter for him because, in his words, he doesn't want to punish working people. Are you supportive of any cuts to Medicaid?
Well, first of all, Medicaid is a very important program for my district. And, I come from a strong Republican district in Northeast Indiana, and I know that a lot of businesses, a lot of my constituents have been put in a very difficult place to pay for their health care costs. And Medicaid is one of those options that many people turn to. Whether it's a Medi-Share type program or Medicaid, we know that health care costs are out of control and are skyrocketing. And I think what's really important here, as people talk about all of these programs, whether it's what the DOGE team is doing at the White House, what President Trump is asking for, is that we look at every facet of government to make sure that there's no waste, fraud, and abuse. And I'll tell you, we know in the Medicaid program, there are professional fraudsters out there. There's a lady in Connecticut that was just charged with taking over $1.5 million out of the Medicaid program. That's money that could have been given to a single mother in my district to help her make sure she covers her health care costs. So there's a lot of work that can be done on all spectrums of government spending.
And I hear you on that. I just want to clarify, you would or would not be okay with any cuts to that program?
No, again, I think it's about looking at the program, and that's what Elon Musk and President Trump what President Trump has asked Elon to do, and his whole cabinet. I mean, that whole cabinet room is a strong group of leaders that are going to go to each of their departments and ask each person to make sure that there's no waste, fraud, and abuse. What is excess? What could be eliminated? I was a president and CEO of companies, and I know that you have to depend on your teammates to make sure that we eliminate the abuse of any sort of spending. So if we're going to look at all of government, and including Medicaid, and of course all of the SNAP programs, the welfare programs, subsidies, tax credits, I think everything should be on the table to look at. But again, I think we can do this without cutting the benefits that people in my district and other districts really depend on, and eliminate the waste. This government hasn't had anything like this that I can remember in a long time, and then we're going to find a lot of savings.
And yeah, and you mentioned a lot of people in Indiana. We got some stats on that. Medicaid covering 41% of births in Indiana, 3 in 8 children, and 2 in 3 nursing home patients, as you were just saying. You know that.
Yeah.
And I just want to ask on kind of their behalf, should they be worried about any of their benefits going away?
No, and again, Medicaid is a partnership between the federal government and state government. And so I know that this is a big issue for our governor, Mike Braun in Indiana, and our state legislature. They're already looking at this. Let me give you an example. I was talking to a hospital CEO, and this just shows how the system is entirely upside down. 60% of his patients at a hospital system are on Medicaid, but it's only 30% of the revenue for that hospital system. That's just not a sustainable solution. And so we're going to have to address the real problem. It's not Medicaid. The real problem is the cost of health care. Inflation has driven these costs out of control, and that's what we really need to start focusing on next, is the cost of health care, not necessarily how these programs pay for them one way or the other. We shouldn't force those who depend on a program like Medicaid to pay for the program and the abuses that we know are going along with it right now.
And I do want to ask you how you see this playing out, in the sense that the Republican senators on the other side of the Capitol there are wanting changes to this proposed blueprint. House Speaker Mike Johnson just told my colleague, don't change too much, because essentially it was tough to get that over the line in the House. Where do you think House Republicans will be willing to compromise with their Senate colleagues?
Well, we're a bicameral legislative body, and, being a House member, we have done our work. I'm on the House Budget Committee, and this was a tough lift. But at the same time, what I sense from those in our swing districts and those that are on, districts across the spectrum in our conference is that we all know that we have $36 trillion of debt. That is not sustainable. We're paying more on our debt service and interest than what we're paying for our military. And so something has got to be addressed, and every member of our conference, for the most part, is all said, we're here to make those difficult choices, and I applaud them. And I think, you know, in the long run, we do the right thing on policy, the politics will take care of itself.
And I know you have said that the debt's important to you. You've called it the biggest threat to our national security. A lot of
Yes.
Republicans would like to see Trump's first-term tax cuts made permanent. A nonpartisan committee for a responsible budget estimating those could cost a minimum of $3.9 trillion to make permanent. Republicans trying to find some $2 trillion in cuts. Are you comfortable with that math?
Well, and I have been saying, you know, internally, and I know that the idea has been tossed around, but because of the Congressional Budget Office's scoring system, by making those tax rates permanent, that is a big cost to the federal government. I've proposed and said that, look, we could extend these tax rates for another 4 or 5 years. That would bring that cost down. So that way we don't have to. If we get into to all of the spending and different programs, and we see that it would cut Medicaid, I would say, look, let's back off the tax cuts and not affect Medicaid. So that's something that I've talked about and proposed, because we can always come back in 4 years and make those tax cuts permanent, those tax rates, and that way Medicaid is not affected. And I think that's where most of us are all at on the Republican conference, is that we want to make sure that we don't affect those folks in our districts that depend on Medicaid and have been forced to go to Medicaid, and making sure that the economy grows, we cut spending, and then we start getting to a balanced budget. A balanced budget is really critical for us to start paying the debt down.
Yeah, and would you vote no if it did make them permanent?
No, I would support them. I mean, in the long run, we want to make those tax rates permanent. But again, because of the Congressional Budget Office's scoring, they are saying that's a cost to the federal government. If what it takes is just to extend them for 4 or 5 years until we see what the economy does, and we come back later when those are about to expire again, we can evaluate that. But I would prefer that we look at it from that perspective if we have to. But if we can make them permanent and make sure that Medicaid is strong for not only those who are currently using the program, but it's strong for future generations, that's what our end goal is.
All right, Congressman Marlin Stutzman, thanks so much for your time. We appreciate it.